So my research area, my PhD, actually explored the factors that impacted on increasing Indigenous nurses across the country. One of CATSINaM's strategic priorities, so increasing the number of Aboriginal and Torres Strait Islander nurses. I'm making an assumption, because of my work in the area and my leadership in Indigenous nursing and midwifery, that I've been asked to come along and share some of the work that we've been doing recently. So my current position is as Griffith University's Foundation Professor for First Peoples Health, and more recently a dual position which is Director of the First Peoples Health Unit, of which I was instrumental in establishing, and also a privilege to be a part of that piece of work. And we've been doing a piece of work around curriculum which ensures that all of the health graduates at Griffith University have the necessary skills and attributes to be able to work effectively with Aboriginal and Torres Strait Islander Australians. An important piece of work because it ensures that our graduates don't inadvertently perpetuate past behaviours that have been done by health professionals prior to them. The challenge is because we've got a system that's Western dominated, so you've got not only a system but also individuals and units that make up a system who don't necessarily have the right capability to be able to make decisions that are about the betterment of Aboriginal and Torres Strait Islander people. And the only way we're going to get people into those positions is that we increase Indigenous people coming out of the university system. Unfortunately, our numbers are quite low at the moment because the system is culturally unsafe and the people that they work with are culturally unsafe, so they tend to move away or exit that system, which means then we don't get people into the leadership positions. One of the things I want to talk about on Thursday is ensuring that we don't focus just on building the cultural capability of non-Aboriginal and Torres Strait Islander people, but we also focus on ensuring that we increase Aboriginal and Torres Strait Islander nurses and midwives, because the best learning that can happen in any environment is an Indigenous and non-Indigenous nurse and or midwife working alongside each other. What's really missing is research and evaluation that evidences the skills and the attributes and the knowledge that Indigenous nurses and midwives actually bring to nursing and midwifery, that it's more than about a positive experience for an Aboriginal or Torres Strait Islander patient, that they bring a knowledge set that we can't teach within a university, and there needs to be much more value and acknowledgement placed upon that.